Good morning, Queensland. Good morning, Gold Coast. And it's wonderful to be at TAFE this morning down here at the Gold Coast, but I'll have a bit more to say about that in a moment. First of all, I'll just like to give everybody the COVID update, which I know everyone looks forward to hearing first thing in the morning. So we have 3 new cases, but they're all in hotel quarantine. So that's 0 community transmission. So everything is looking very positive, Queensland. So thank you very much. And of course, we really need people, if you are sick, to stay at home and go and get those tests. That's absolutely critical. In terms of vaccines, in the last 24 hours, we've had 5,467. So we've reached that 100,000 mark of people who have been vaccinated. And I welcome the comments this morning in relation to the AstraZeneca that we're hearing out of Europe, that of course the Prime Minister is talking with the TGA, and I'm looking forward to getting that update at National Cabinet tomorrow as we continue the vaccine rollout. In more good news today, I'm pleased to be here at the Southport TAFE, and what a wonderful facility. And we know that our TAFE facilities across Queensland are preparing our students for the future, and this $10 million investment here is preparing our health students for the professions that they want to go into the future. So whether it's nursing or allied health, around 3,000 students will go through this new facility who are already enrolled, and around 1,300 are enrolled in nursing. And we just saw some of the great, Deb was showing us some of the great new technologies that are being utilised here. In fact, not just a Queensland first, but an Australia first. So our students are getting the most up-to-date technologies and preparing them for careers in health right across the Gold Coast. And of course, they're connected with the Gold Coast University Hospital, just being up the road. My government's also very proudly investing in free TAFE for under 25-year-olds and our free apprentices, and already more than 3,000 young people are benefiting from that across the Gold Coast region in particular. So we know that going through a pandemic, we need the future nurses and allied health professionals. It's absolutely fundamental. It's very, very important. And I want to commend all the staff here. Our TAFE students are great students, and it is great to see the investment that my government is putting in, $10 million here, is about training for that future. So that's absolutely critical. Before handing over to the Minister, I also just want to reiterate my calls for a National Women's Summit. I've said yesterday, and I'll say it again, this is absolutely critical. This is the moment in time where we need to address gender inequality in our country. Now is the time. It is absolutely critical. We know that women get paid on average 15% less than men, that women have less superannuation, and that women have to juggle work and childcare responsibilities, and we need to have affordable childcare to allow even greater participation of women in the workforce across Australia. We also need to look at issues of sexual harassment in all workplaces across Queensland and across Australia. So I've written to the Prime Minister. I'm looking forward to talking about this tomorrow at National Cabinet. And can I thank all of the women across Queensland and across Australia that are supporting this call, and men. In fact, the social media has been phenomenal in terms of the reach in terms of this proposal, and I want to thank everyone. And please share it. I think it's absolutely vital that we have this National Women's Summit. And like I said, happy to host it here in Queensland, or if the Prime Minister wants to have it in Canberra, that would be terrific as well. And I know back in 2016, I called to have the issue of the prevention of domestic and family violence on the national agenda. And we had a national summit, and we still have meetings about that critical issue. But this is a much broader issue. This is about fundamental women's equality and women's standing in Australian society. So it doesn't get more important than that. And I really want to thank the women of Australia for supporting this call, and this is a moment in time that we can bring about generational change. So look, I'll hand over to Minister Farmer to say a few words, Minister Scanlon, and then we're happy to take some questions. Thanks, Di.
Thanks, Premier, and it's fantastic to be here on the Gold Coast to open this $10 million facility for nursing and allied health students. This is part of the $150 million that the Palaszczuk government has invested in TAFE facilities across the state since 2017. As if we didn't know it already, I think the last year has really emphasised the importance of our frontline health workers. And here on the Gold Coast, people seem to have been really inspired by that, because we have seen a 40% increase in the last year alone in our nursing and allied health courses. So important for the Gold Coast when we're projected to see an increase of 1 million people, up to 1 million people in the next 20 years. We need to make sure that those people have access to the best quality health care available. So this facility is just about that. It's the first of its kind in Australia. We've got HaloLens virtual reality, lab environments, simulated ward. It is just about as real life itself. So we're going to make sure that those students are graduating with the best practical experience possible, and we're already receiving that feedback from the Gold Coast Hospital and in other sectors that the students here have an edge, have some practical experience that they have just not seen before. So it's just fantastic that this facility is going to provide that going forward.
Thanks, Minister, and it's wonderful to be on the Gold Coast today. I, of course, came here last year when it was under construction, this facility, and now it looks and feels like a real-life hospital. We're investing significantly in our hospitals across the Gold Coast and across Queensland, but it's also important that we're giving young people the training and skills they need for the jobs of the future. And as the Minister mentioned, we've seen a huge uptake in the amount of people on the Gold Coast taking up nursing and allied health, and that's largely as a result, too, of the demand and population that we're seeing, demand also in our ageing population and the need for these services. So these are good, full-time, stable jobs, and we're making sure that we're giving young people those opportunities. And as Minister for Youth Affairs, I'm particularly pleased to see 3,400 young people on the Gold Coast take up that offer of free TAFE and free apprenticeships. But of course, it's also about delivering the world-class facilities that we need to train these young people in. And this is one of those facilities, but we're also investing around $42 million across the Gold Coast in our TAFE facilities. I just opened the new Trades Training Centre on behalf of the Minister in Ashmore a couple of weeks ago. We've got work happening on the Coomera TAFE as well as a new TAFE in Robina. There's a lot of investment being distributed throughout the Gold Coast to make sure that Queenslanders are getting that skills and training that they need for the enormous jobs growth that we're going to see on the Gold Coast as a result of so many people wanting to move here because it's such a brilliant place to live. So I want to thank the Premier and Minister for their investment in a really important part of our economy.
Thanks, Megan. I'm happy to take some questions.
Premier, what's your message to Queenslanders in the wake of the ongoing concerns over the AstraZeneca vaccine in Europe?
Thanks, Greg. Look, in terms of the AstraZeneca, we will always take the advice of the Chief Health Officer, and as we know, the Chief Health Officers meet every day. So I'm looking forward to hearing the advice from the Chief Health Officers later on this afternoon. But I'm quite confident that the Prime Minister will have more to say about this later on. I know that he is taking this issue very seriously, as are other leaders around the country.
What would you say to residents in aged care who might be a little bit concerned after yesterday's news?
Yes, well, I'm advised that they're doing some more further investigations into that particular incident and tragedy, and we'll be getting some updates about that from health. But, you know, in terms of the vaccine, the benefits outweigh the negatives, and I think everybody, you know, we didn't even have the option of a vaccine 12 months ago when we started going into this pandemic. So there is light at the end of the tunnel. Like I said, over 100,000 people have received their vaccine already in Queensland, and I know that the Commonwealth is addressing these issues with the TGA. So can I just leave it with the Commonwealth to make further statements about that out of respect for the Prime Minister?
Premier, women make up more than 2/3 of the public sector in Queensland. How concerned are you that last year there was 140 reports of sexual misconduct?
Yes, well, that's why I mentioned this morning that we are going to be putting in place an equity officer. That was a commitment that we gave. I think that's absolutely very important. The good news, though, is people are reporting. So the statistics that you have are because people are reporting. What I am concerned about is that there could be thousands of women out there in other workplaces across Queensland that aren't reporting. So once again, these are issues that I believe should be addressed at a National Women's Summit because they are real issues.
In a statement, you said that you were aware of 2 complaints in ministerial offices. Can you tell us the nature of those complaints?
I can't go into who they were, but I can say that neither were relation to sexual assault, and both have been are being looked at independently by the department. Yeah.
The public sector union Together says that all ministers should be finding out the extent of sexual misconduct in their departments and whether they're being handled properly. Is this something that you'll encourage, and will you be doing it?
Look, I've spoken to the Together union previously about how important it is to have this equity officer. So we really want to advertise for that position as soon as possible, and it's a commitment that we made before the last election.
Premier, do you think it's more appropriate that a woman, a female leader, hosts the Women's Summit, yourself?
Oh, look, what we did last time with the prevention, that's a very good question, with the prevention of domestic and family violence, is that, it was my recommendation, but the Prime Minister, being the Prime Minister of Australia, took the lead. And I don't think there's any concern about that. But as one of only 2 female leaders nationally, and when I raised the concept of having a summit on the prevention of domestic and family violence, remember, I was the only female voice at the COAG. Now there's 2, myself and Gladys. But these are really significant issues, and I think what Australia has seen over the last couple of months is this groundswell of support by women of all different ages, all different backgrounds, calling for change. And like I said, now is the time, and we cannot miss this opportunity in time.
The Together Union's calling for a review of all policies in relation to how sexual misconduct is dealt with, and better education starting at a school level. Will your government undertake to do this? Yeah,
well, look, I'm happy to look at those issues again. Of course, I've always been a very firm advocate about respectful relationships starting at the school level. And in fact, we have actually started rolling that out as well across Queensland schools. So, of course, we can do that in schools, but it also needs to happen in private homes as well. So there's a bit of a parental responsibility here as well. And of course, the government can look at other avenues through such avenues as education.
I mean, you said there would be investigations into the death of the elderly woman yesterday. Will Queensland Health be monitoring those investigations?
Yes, because they have to look at all of those circumstances in terms of other illnesses the person may not have, and because it's private details, I think the best avenue is for them to have a look at that.
Are you concerned about that death?
Look, I have to get more details on that, but any death is a tragedy, and I think they need to look very closely at were there any other conditions or was it vaccine related.
Has there been any link for the vaccine?
I've not been advised yet, so I'll let Dr Young report on that, if that's okay.
Premier, given your government's bailout of Virgin last year, are you disappointed that they're not going to be flying the New Zealand routes until October?
Look, that's a matter for them, but the good news is that, the New Zealand tourism, in terms of New Zealand people coming here, residents and holidaymakers coming to Queensland, it's our second biggest international tourism market. So I think that's going to be really good news for Queensland when that opens up in April. And just in terms of the recent, that we're in the midst of school holidays, my understanding is that Gold Coast operators and accommodation is going very well, and some of the busiest routes are those routes between Sydney and Melbourne into the Gold Coast. So hopefully the Gold Coast will continue to have a bumper school holiday record. Yeah.
Last question.
We know of at least 4 private hospitals that are wanting to vaccinate their own staff with
Yep.
told by Queensland Health that they can't. Is that something that's on the horizon, or are you sort of keeping?
Yes, I've
supplies?
had some advice on that. So you mentioned the word supply. So supply is a matter for the Commonwealth Government, which the Prime Minister addressed yesterday and acknowledged that there are issues with supply. And in relation to the private hospitals, that is for the Commonwealth. The Commonwealth is undertaking to do the rollout of the vaccine in private hospitals. Like I said, Queensland is responsible for 30% of the vaccine rollout, and the Commonwealth Government is responsible for 70%.
Premier, do you think it's adequate that RTI requests for information about sexual harassment or bullying within the ministerial offices is refused? Don't Queenslanders deserve to know this?
I've just updated those figures, and RTI is a matter for independent RTI officers.
Premier, would you consider setting up a mass vaccination hub like they're having in South Wales?
Yeah, that's a good question, and we have been looking at some of those contingency measures, and that's not a bad idea. But if you're going to have a mass vaccination centre, you need to have a lot of vaccines. So once again, you can't have all this demand and not have the supply to meet it. And the last thing I'd want to see is, thousands of people turning up to a centre and not having the vaccine. So, as we progress with the vaccine rollout, when we have the supply, I think we'll be looking at a whole range of other measures. Like I said this morning, I think the simplest method at the moment is in terms of people going to their GPs, or when it gets rolled out to the pharmacies, just like we do with the flu shot, and many people are already starting to get their flu shots. So,
Premier, we're seeing a lot more cranes on the Brisbane skyline at the moment. Is
Yeah.
that a good sign of the way that the economy is tracking?
look, absolutely, I think it's great to see. I know people talk about the crane index. I like to talk about the crane index and the plane index. So we're seeing a lot more planes in the sky, which is fantastic, which means our tourism is getting back. But of course, to see the fact that we're going through a world pandemic, and to see that construction is happening and flights are happening, I think is very, very positive news, because what that means is fundamentally jobs. And everything we've been talking about today is about jobs. When I talk about a National Women's Summit, it's about addressing those issues of pay and gender inequality when it comes to pay. But also too, down here, our investments are about the future and making sure that people have long-term secure jobs. And health, we know, our health workers are long-term secure jobs. And when it comes to construction, our construction industry on the large did not stop during the pandemic. It kept going. In other countries, it has been completely shut down. So I'd like to thank, I know a lot of the students today and the staff have come in on their holiday, so thank you very much for showing me around your wonderful new facility. And it's $10 million of great investment, because we're investing in our people, and that's who matters most. Thank you. Thanks.